Hi, Dr. Roseann here, and today we're talking about activities to teach children how to put the brakes on. I'm an integrative and pediatric mental health expert who's on a mission to change the way we view and treat children's mental health. If you're new to my channel, hit subscribe and turn on your notifications so you get my videos every week. Let's dive in. Some kids really have a hard time with impulse control, or what I like to call putting the brakes on. So what is impulse control? It's the ability to shift gears, stop an action, or ignore something even. Impulse control can be really, really hard. There's that fantastic experiment where they leave a child in a room with marshmallows and they tell them to not eat it. They get to see which child eats it and which didn't. And we think of all kids as being somewhat impulsive. Of course, right? They're learning that sometimes you can't have everything you want. When is impulse control a clinical issue? Well, impulse control becomes a clinical issue when it interferes with what we call our daily functioning. So when it gets in the way of our school, our friendships, our relationships, and our work. We can all think of an impulsive adult in our life. Well, kids are learning to control their impulses, but at times it's a clinical issue, and sometimes it's just something that needs to be worked on. And I'm always positive, and I think all things can be worked on. But what we know about behavior is the earlier we address it, the easier it is to turn it around. And why is that? Neurologically, we're not forming those habits, or when we do form a habit, it's not so ingrained, and so therefore it's easier to unwind. I want to share an activity that you can use as a therapist, a school professional, or even as a parent. It's called putting the brakes on. My activity, putting the brakes on, is a way for kids to actually visualize times they don't put the brakes on and times they do. We want to help kids not be defensive about their behaviors and really start to be insightful. When kids can see what they're doing wrong, they can change it. When we focus on when kids are able to put the brakes on, kids are better able to make those connections, and it gets reinforced, and therefore it's more likely that they will apply the brakes without an adult nagging them. We'll call it reinforcing or cueing them. But, it creates this relationship either as a parent or a provider where they over rely on you. What I like to do in my worksheet is either have a child draw or write down those times. Meet kids where they're at. This is a great activity for teenagers, young children. You can do it over and over again, and I would encourage you to do it over and over again so that we're reinforcing children to put the brakes on. Impulse control is hard to learn for an impulsive child, whether they're behaviorally or verbally impulsive, right? So we need that higher level of reinforcement. What I like to do in this activity is also to get children to connect to their bodies. How did it feel when you put the brakes on? How did it feel when you didn't? And get kids to start to understand and recognize from that bottoms-up approach that I talk about. We really want kids to connect to their body so that at a subconscious level, they start making these changes on their own. Putting the brakes on is a wonderful activity for parents, school professionals, therapists, or really anybody that works with kids. I've even had churches use this. So what's my Dr. Rowe know? It's that thinking your child is acting out on purpose. Anybody who is impulsive never really wants to be impulsive. They just can't put those brakes on. It's our job as parents and professionals who are caring for these kids to help guide them. What's my Dr. Rowe go? It's having that patience to help an impulsive child. We know it's not easy, but they need us to be as patient as possible. Think about it from a brain perspective. Their brain literally has a hard time stopping. So let us aid their brakes by teaching them those ways, by positive reinforcement, all the ways we talked about. So remember, if you or a child you care about is struggling, it's going to be okay. I'm here to show you how to help a child feel calm, alert, and feel good about themselves. I want to hear creative ways that you're helping a child with impulse control. So drop it in the comments below. Catch you on the next episode, and remember to subscribe to the Dr. Roseann channel, where we talk about natural and effective ways to reduce and reverse mental health.